Hello, my name is Claudia Burgett. I'll be doing my concept health assessment video today. I'll be doing a 360 of the room. This is my patient, Fernanda De La Rosa. I have provided privacy by pulling the curtain around us and making sure that there's no one else in the room. Do you feel safe here?
Yes.
Do you consent to being in this video?
I consent.
Perfect. Fernando, can I clarify your full name and date of birth on your bracelet?
Fernando Daniel De La Rosa Gonzalez.
And your date of birth?
March 10th, 1997.
Okay, that matches everything that's on my online charting system. Fernando presents here with a persistent cough over 2 to 3 weeks. He doesn't take any medications at home. He does not have any environmental allergies. He doesn't have any family or personal history of any cardiac or respiratory illnesses. Fernando, tell me more about your cough.
I've had it about 2 weeks.
Okay. Is it more of a dry cough or do you have any phlegm?
There's some phlegm.
Phlegm. Is it thick or thin?
More thin.
Thin. And what color does it have?
It's just clear.
Just clear phlegm?
Yeah.
Okay. Do you have any nasal symptoms like a runny nose, an itchy nose?
No.
No, sounds good. Do you feel any shortness of breath when you have the cough? Okay.
Yeah, there's some.
Okay, any pain when you have the cough as well?
Yeah.
Where is it?
Like right in the middle.
In the middle? Is it more of chest pain then?
Yes.
And it only happens when you cough?
Yeah.
Okay, you're pointing here, that means it's more mid-sternal?
Yeah.
Have you had this pain before?
I have not.
Okay. On a scale of 0 to 10, 10 being the worst pain, how would you rate this pain?
It's like a 3 or 4.
And what about the shortness of breath? Do you feel very short of breath, 10 being the most short of breath, 0 being not so much?
About the same, like a 3 or 4.
3 to 4? Okay. Sounds good. I will be continuing with a respiratory assessment. I'll be listening to your lungs. First, we'll start with your anterior chest, so the front of your chest. Then we'll move on to the lateral, and then finally the posterior, which is your back. I will be checking if your trachea is midline, which it is, which those are normal findings. I'll start by listening to the abscess of your lungs, which is just right above your clavicle. I'll be listening through my stethoscope, through the diaphragm part of my stethoscope. Just let me know if at any point you feel uncomfortable or you want to break, you feel shortness of breath, or you feel any pain at all, and I'll stop, okay?
Okay.
It might be a little bit cold. When I press the diaphragm on your chest, please take a deep breath, and then once I move on, take another one, okay? I will be assessing your chest bilaterally to make sure that my findings are the same on both sides. After listening to the abscess of the lungs, I will be going to the second intercostal space to listen to your upper lobes. Take a deep breath for me. Moving to the left side. I'll be moving on to the third intercostal space, which symbolizes your middle lobe on your right side of the lungs. Moving on bilaterally, this is still the upper lobe of your left lung. This is due to the fact that your left lung only has 2 lobes versus your right has 3. Perfect. I will be moving under your breast here. And finally, the lower lobe on your left lung. Perfect. You're still doing okay? Sounds good.
Very good.
If you may move just to your side, I will be listening to your lateral side sounds. Perfect. I'll be going mid-axillary here. If you could just lift up your arm for me. Perfect. Take a deep breath. And another one. Amazing. You can set your arm down. You can rotate on this side if that's okay. I'll be listening to the other side. Once again, lift up your arm for me. And one more. Sounds good. You can set your arm down. Fernando's vitals were completely normal. He had a temperature of 36.5 degrees. His respiratory rate was 18 beats per minute. His O2 sats were 98 on room air, and his blood pressure was 127 on 82, which is completely normal, and his heart rate was 73. I will be asking Fernando to move facing this way so I can listen to the posterior side of your lungs. Perfect. So same thing, I'll be going just a little bit more. Facing the camera, thank you. So I'll be listening to I'll be going to your C7 here, once again to the abscess of your lungs. Take a deep breath. Another one. Amazing. And now I will be moving on from your T3 to your T10, making sure that I don't go over the scapula because that might diminish any lung sounds. And I'll be moving in the latter direction, okay? So take a deep breath. I will be moving a little bit more lateral here so I can get a good listen to the full lower lobe. Okay, perfect. You can turn back around if you'd like. So all of Fernando's lung sounded perfect. They were all clear on the anterior chest as well as the posterior chest. I didn't hear any adventitious sounds, which means any abnormal sounds. For example, any crackles, wheezing, or anything of the sort. So that looks really good. Moving on to your chest pain. Are you experiencing any chest pain right now?
No.
Okay. So that's perfect. I will be doing a little cardiac assessment. So once again, I'll be listening on your anterior chest, but more cardiac related, and then I'll be going through your peripheral pulses. So I'll be starting at the neck and then moving my way down to your feet. So once again, my diaphragm, I'll be putting it on the aortic valve, which is on the right sternal border. Moving bilaterally to the pulmonic valve. I'm going to be moving to the third intercostal space of the Erb's point. As well as on the fourth intercostal space, which is the tricuspid valve. And then finally to the fifth intercostal space, which is the mitral valve. Sorry, I'm moving. This is where you can auscultate an apical pulse if needed be. So yours was 76, which is comparable to your previous one when we took your vitals, which was 73. So everything was looking good. I will be taking now your peripheral pulses, starting at the carotid. So I'll do your right side first. Compare it bilateral. Amazing. I'll be moving on to your brachial, which is right above your elbow. Bilateral. Amazing. I'll be feeling your radial pulse right around your radius. Compare it. You're still doing okay?
Doing good.
Next pulse is going to be the femoral pulse, so just be feeling right under your groin if that's okay. Next side as well. Moving on to your popliteal, which is just on the other side of your knee. Amazing. Other side as well. Posterior tibial. This side as well. And then finally your dorsal pedalis. I'll just be removing your shoes for this one. I'm just feeling right on top of your foot. Perfect. And then this foot as well. Perfect. Do you have any questions or concern at this moment, Fernando?
No.
Okay. Everything looks great. Your cardiac assessment went well. Your respiratory assessment went well. I will be consulting with the doctor and see what the team decides to do. If you don't have any questions, just hang out in the room. If you need any help, please pull the call bell and someone will come assist you. And as soon as I get some answers from the team, I'll round up with the doctors and then I'll come keep you updated, okay?
Sounds good. Thank you.
Alrighty, nice to meet you. I'll see you later.
Nice to meet you.